Yeah, hi everyone. Welcome to my channel. My name is Dr. WAN. I am here today to talk about men's health part 2. Remember the first video or clip I did say that I'm going to break it down into parts. So this one is part 2 and they're going to be part 3, part 4 and so on. I choose to break it down to many parts to facilitate my students following up and as well as my patient, because putting all this information in one video, it might be a little bit challenging for them to follow or to concentrate, so I choose to make it this way. Now in this part 2, we're gonna use two birds to treat a patient. That is, we're going to use one stone to kill two birds. So meaning that we are treating two conditions here. So we are talking of erectile dysfunction, popularly known as ED, and also talking about BPH. BPH stands for benign prostate hyperplasia. So that's what it stands for. The interesting thing here is, most of the time, erectile dysfunction masks BPH and most people don't even realize it. So I really want to hamper on this. I will treat it also as pathology and eventually come up with a therapy on what to do. So when we talk about BPH here, remember there's a video for that. It's a mild form of inflammation, or call it growth of the prostate glands. Essentially, that's what it stands for. So, as you know, as you grow older, that prostate glands also tend to increase in size, especially in the black population. Once again, when you have another medical condition, say diabetes for example, that also helps to increase the size of that gland. So you find it a little bit challenging as you are getting older. Once you are over 50 years of age, I strongly recommend everyone to go and do the test called PSA. That's what you have to do. I don't know in Africa how much is the cost of it, but you have to do it. It is for your own good, knowing that value. So, classical symptom with regards to BPH is urinate. You find it challenging urinating. For instance, you find people going to the washroom, they spend so much time. Take for instance, before the urine comes out, it is slow. Some even find it challenging. Some experience burning sensation when they have BPH. So when you're having that sensation and the mixture, or what they call flow rate, is slow, meaning it means that your gland is having some kind of impairment, or the size has increased. So in that case, you will need to do the exams called PSA for us to tell if how things are going. And generally, it's supposed to be less than 4 for a normal person. When it's above that level, it is of concern, and in that case, you will need some medication. So please take it serious, get this checked, and things should be okay. Now, having said that, when you are having erectile dysfunction, most of the time it is being caused by your prostate. That's what creates that trouble, but people don't understand. So people tend to say they have ED, erectile dysfunction. Yes, they do have it, but you need to understand the origin, where it is coming from. Some might be that you are stressed, you must have changed your new job. There are lots of things going on there that could be a factor. So I'm not just saying that stress is the only thing that I have to look at it, but I want to incorporate P as a value. So I have a patient who called me a while ago saying that he's having erectile dysfunction and everything has been checked, all is negative, but I never saw P as a value. So that's what I wanted you guys also following me to go to the hospital and get this thing checked if you are experiencing erectile dysfunction. Having said that, there are medications that can be used for those who choose to do so, or you go the natural way. Natural way meaning that I will tell you what to eat and what not to eat in order for you to regain back your erection as a man. So we have the typical Cialis. Cialis now, or some people call it Cialis, they have various values or strength. You have the low dose, which is 5 milligram once a day, and you have the 20 milligram on demand. So the 5 milligram once a day, it can actually be split down to 2.5 if you wish to do so. The good news is once you are on that situation, that is when you have erectile dysfunction and it discovered that you do have also BPH symptoms, like I said before, you should be on Cialis 2.5 milligrams. That Cialis 2.5 milligrams has two functions. The first one, it is to facilitate your ability to urinate, and then the second one, it is for erection. So you see now what I was just saying, that you use one stone to kill two birds. So the two birds here are BPH and erectile dysfunction. So that's what has to be done. So you can see on the image how it's written there, new indications. Could your patient with ED also be living with BPH symptom? So that's what it says here. And you see on the flyer, it's saying that Cialis 5 milligrams once a day is now indicated for the treatment of ED, which stands for erectile dysfunction, and the signs and symptoms of BPH. BPH, which stands for benign prostate hyperplasia. So comorbidity is what you see there written, ED and BPH, in addition to the signs and symptoms of BPH alone. So that's the good news here. You can get that medication for the two medical conditions and you should be fine. I usually advise my patient to start on low dose, that is 2.5 milligrams, in order for the body to adapt to it, for those who can afford to buy the medication. So, two conditions, one patient. Only Cialis is indicated to treat both ED and BPH symptoms. So, that's it. And now, let's look into the natural procedure. Those who cannot afford to buy Cialis, they can equally do something else, which I call it kind of a natural fix, not quick fix. Quick fix is when you use medications to get it done faster, whereas the natural way might take some time. So the first thing here it is to evaluate yourself if you're not under stress, because if you are under stress or some psychological dysfunction, it goes to create a situation in your system, that is, your value for corticosteroids spikes. When that value for corticosteroids spikes, there's that sensation of stomach burn. You find yourself at times burping as if you are having ulcer or gastritis. So those are some classical symptoms. If you are someone that you burp a lot or you puke, then know that you you are under stress and the corticosteroid in you is building up. So the first thing here is meditation. So meditation here means that you keep away your phone, you find a quiet environment, you stay there for at least 1 hour. That 1 hour time, believe me, if you go to the laboratory immediately and check your blood value for corticosteroids, you will see that that value is quite low. That's what we call the cortisons in your system, or cortisol, whichever way you want to call it. So that's the first thing. When you are able to make up for the quietness, you are able to meditate, then it goes a long way to bring down that value. So medication is number one. Now, after medication, your lifestyle. Lifestyle here also means a lot, meaning that you stay away from processed food. Processed food will not help you in any way, and so you get it from natural. Go green, like I've always been saying. And a good example is watermelon. The watermelon, if you look at it, is kind of red inside. That reddishness inside has what we call L-arginine. L-arginine is a precursor of the nitric oxide, because the L-arginine at the level of your liver breaks down to release nitric oxide. And the nitric oxide now, at the level of your arteries, they do what we call vasodilation. And like so now, blood can flow now at the level of your penis and does the good job. So that's what you have to get used to it. Another thing is beetroot. Beetroot also, you need to make sure you consume beetroot at least once a week. Now, before I conclude with arginine, the quantity that you need for arginine daily is 500 milligrams. You need that value in order to keep back your strength and everything. Otherwise, you are just doing the wrong thing and you're wasting your time. Beetroot contains iron, and you need 7 milligrams of iron in order to boost things up. Zinc also is needed. All those things, you get them from vegetable. And beta carotene, which is, you can tell from the name, it comes from carrots. So eating carrots also will give you that value, which is 4.8 milligrams that you need on a daily basis. You have copper, you have folic acid. Folic acid, you need 200 micrograms, which you get it from vegetable. Vitamin B12, that one also you can get it from plants. And so these are all the things that you need, as well as vitamin D. To be more precise, vitamin D3. Pawpaw is good in that. So those are the things that you need in order to regain back your strength, your capacity, and everything, and be able to function like a man, as I've been saying. So once more, my name is Dr. WAN. Please subscribe to my YouTube channel, like it, and send questions, and I will answer you. So before I call it off, a reminder is to check for your stress level. Once your stress level is addressed, you will not be experiencing erectile dysfunction. And again, like I said before, at times BPH is being masked. So most men don't even know that they have BPH. And a classical example for you to tell that you have BPH is when you go to the washroom. If in the washroom you find it hard to urinate as you used to urinate, then you have BPH. And for you to actually prove it clinically, it's just to see your doctor, and they will do for you a test called PSA. That PSA now tells you the value. If it's above 4, then it is of concern. But again, even if it's 4, you can still be having that same difficulty. So we will see how to bring it down to normal. And like I said, in that case, I always recommend Cialis or Cialis 2.5 milligrams to be taken on a daily basis. that 2.5 milligram does two things. So we are using one stone to kill two birds here. And the two birds are erectile dysfunction and benign prostatic hyperplasia. So those are the two things that we do for those who can afford to buy the drug. If you can't afford to buy the drug, then you have to use natural plants. They go the natural way, which might be longer but efficient. And the plants are all simple to get for you. You have things like the beetroot. Beetroot is good for you. You have green leafy vegetable like okongobong, okra, and other stuff. And then you do have what we call the beetroot, watermelon, all those things. You need them in order to keep yourself going. You have to eat this thing on a daily basis because you need to hit that 500 milligrams for arginine, which comes from only watermelon. So that's what I want to say here. Feel free to get back to me, ask your questions, and I'm more than happy to help you. Thank you for listening once more. My name is Dr. WAN. Have a wonderful day. Ciao.